The concept of booster shots enjoys broad support from experts given the relentless surge of the Delta variant, especially for the immunocompromised. Dr. Mark Jarrett is Deputy Chief Medical Officer at Northwell Health.
Such as people who've had solid organ transplants, such as kidneys or liver or heart, because of the medications that they're on, they do not have a very good response to the first two injections if it's Pfizer or Moderna, or to the AstraZeneca if it's, the Johnson & Johnson if it's a single dose.
Dr. Jarrett also includes people undergoing cancer therapy or those not undergoing cancer therapy who have certain types of leukemias that lower their antibody response. But it appears many Americans are seeking out a third dose on their own, meaning there could be a new surge of young, healthy people jumping ahead of the vaccine-deprived. The director of the FDA emphasized that people whose immune systems are not compromised, the vast majority of Americans, do not need additional vaccine doses. Although a decision on the efficacy of booster shots for healthy adults could be made later this year. Yesterday's FDA decision comes after a recent study found that vaccinated immunocompromised people were 485 times more likely to end up in a hospital or die from COVID compared to the vaccinated general public. Epidemiologists have been weighing the benefits and risks of booster shots for months now, but it wasn't until the Delta variant of COVID began spreading across the country this summer that the FDA took up the additional shot for vulnerable groups.
At least 117 countries now have the Delta variant since it was first detected in June of 2020.
For that reason, Dr. Jarrett suspects that upcoming guidance will increase the number of people getting booster shots to include healthy people over 60 or 65 who have less of an antibody response than a healthy 30-year-old.
I think eventually, before the end of the year, healthy 30-year-olds probably will receive a booster after 6 months. For the very severely immunocompromised, we're not going to wait those 6 months. We're going to wait what appears to be probably about 28 days after their last shot. But for the rest of the people, it may be 6 months.
Now, according to the CDC, patients will not need a prescription or the sign-off of a healthcare provider in order to prove that they are immunocompromised and receive an additional dose. According to the director, that vulnerable group makes up less than 3% of U.S. adults. The FDA's decision does not apply to people who receive the one-dose Johnson & Johnson vaccine, as the CDC says there's not enough data to support additional doses just yet. Tamsin, Corey?